Welcome to the Spinal Truth Show weekly podcast edition. I am your host, Dr. Caleb Slater, and I am here with 8 total labrums.
Is that how many labrums?
That's how many. That's how many labrums.
Sir, you are making some assumptions about my labrums right now.
So this week's show is about labrums, specifically the shoulder, but we'll talk a little bit about the hip. And I think a lot of people are going to learn a lot of misinformation that's going on right now about labrums from this show. So I'm kind of excited. For a little bit of background, I was a baseball player my entire life, up through college. I loved baseball. Baseball was life. I was a pitcher. Obviously ended up with some shoulder pain. I ended up having my labrum repaired when I was like 22 or 23. Long story short, it was not my labrum that was the problem, now looking back on it, but despite going to multiple physical therapists, my professors at the time as well, multiple orthopedic surgeons or orthopedists, nobody put it together that my symptoms weren't coming from my labrum, and it led me to have unnecessary surgery.
So you got the standard treatment.
Right, exactly. The standard, so great way of phrasing it. I got the standard treatment. And I had pain, numbness, tingling running down my arm just sitting in class. Even if I hadn't thrown recently, even if I was playing racquetball and weightlifting, even if I hadn't used my arm recently, I was sitting in class having pain, numbness, tingling running down my arm. I was telling my physical therapist, I was telling my professors my symptoms, I told my orthopedist, my surgeon, my symptoms, and they all used the image findings to say, you have a torn labrum, this is the problem. Now, having 16 years experience in orthopedics, I am an orthopedic specialist myself, and having kind of a unique viewpoint on the body, I know that the labrum doesn't cause numbness or tingling. It doesn't cause radiating symptoms down the arm, and nobody picked this up. And this is so easy. I mean, this is so easy, but nobody picks it up. And I know there's going to be other PTs and chiropractors and doctors saying like, yeah, they're going to say, of course I'd pick this up. But I want to ask people, if you've had a torn labrum and you had symptoms down the arm, what did the doctor tell you was the problem?
Well, I think we can. There's a lot before we even get into the treatments that they prescribe for a torn labrum. Why don't you tell us what a labrum is?
Why don't you tell us what a labrum is?
I mean, I actually have learned a bit just from working with you, but before that, I probably couldn't have told you anything.
So, your labrum, you have a labrum around both shoulders and both hips. Your labrum is basically the shrink wrap to your joint. It provides some compression, it provides a lot of stability, it holds in some of your synovial fluid, so it's kind of like the fluid that helps your joint glide around. It protects that joint a little bit. It is basically, the best way I can describe it is it's saran wrap around your joint. Okay. Now, what if I told you that by the time you hit 50 years old for your shoulder, you are 60% likely to have a labral tear, but have no pain from that tear whatsoever?
I would say, well, I look forward to that in 25 years.
20 years? If you're 50 years old, you are 70% likely to have a labral tear in one hip with no pain whatsoever.
So is that because of the slow degenerative process that your body compensates?
It's wear and tear, it's degeneration over time, it's rubbing and grinding, right? But the whole point of this, the big take home, is that throughout your life, by the time you're 20 to the time you're 50, you have somewhere around a 10 to 50% likelihood of having a labral tear if you get imaging. But these people on these studies had no pain whatsoever. So if we just took you off the street, anytime between 20 and 50, and we said, do you have any shoulder pain? You said no. We said, great, we're going to image your labrum. We're going to image your shoulder. Yeah. You have a 10 to 50% likelihood of having a tear. And if they find this tear, they are going to miscorrelate the image findings to your symptoms, if you have symptoms. And they're going to say, this is your problem, this is what we need to treat, and it'll almost always end up in surgery.
So that was going to be my question, because your case was a little different. You were young, so it was more or less a traumatic injury from baseball, right?
You could say like repetitive trauma.
Repetitive trauma, but you're not the standard case probably. So if I'm 55 years old and I'm starting to experience some pain or numbness, tingling, and I go and they find a labral tear, is the treatment plan essentially the same for someone that age versus someone younger like you?
Pretty much, yeah. If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show. So, all right, so the treatment plan is, so if you have a torn labrum, you shouldn't have numbness or tingling. So let's take that out. Let's just say you have shoulder pain.
Okay.
You have shoulder pain, you go to the doctor, they think it's a torn labrum. Okay? They did imaging, they found a torn labrum. First thing they're going to do is inject you with steroids. Cortisone injection with some type of pain medication in it. That does nothing to fix your labrum. You still have a torn labrum, but now you don't have pain temporarily for that. So now you go and you're playing tennis and golf and doing your yoga, or you're just living your life, and the pain that you had, the problem is still there, but you don't have the pain. So already bad treatment.
And are you potentially worsening?
You're likely worsening.
Yeah.
Not potentially, you're likely worsening your problem. Let's say they send you to physical therapy. Well, your labrum will not repair. It will not recover. It has limited innervation, limited blood flow. So it does not repair itself. If you have a torn labrum, you have a torn labrum. It won't fix.
It will never fix itself.
Pretty much never fix itself. So you're going to go to physical therapy, and what they do is they do some stretching to take pressure off of different parts of the shoulder, and they primarily do strengthening and stability exercises. Your muscles cannot really compensate for that torn labrum, if that labrum is your problem. And so the overarching theme of this is that your labrum wasn't the problem in the first place. So that's why you're getting this treatment, and the treatment's not working, because you're getting treatment that's aimed at your shoulder, and your shoulder wasn't the problem in the first place. Your torn labrum wasn't the problem in the first place. And even the treatment that's offered, like the cortisone injection, like physical therapy, doesn't treat a torn labrum in the first place. It can only try to mask it or compensate for it.
So the fact that it's torn, though, speaks to something happening to it.
Right, but remember, this is a common occurrence over the course of your life. By the time you hit 50, 50% likely for your shoulder. By the time you hit 50, 50 to 70% likely for your hip. And I actually think those numbers are low.
Okay. So my question to you, because you're going to say, well, the actual treatment takes place in your spine and your neck, probably somewhere in there. I'm not exactly sure where. But my question then is, did it become torn because of what was occurring in your neck or back, or because of time or repetitive process?
Probably all the above.
Okay.
Why would it become torn from a problem in your neck? You make the argument, so the area that innervates your labrum, so the area that sends signals that could cause the same type of pain. So referred pain is, I have pain in pressing on a nerve in my neck, and I feel that pain down into my hand, even though I don't have any problem in my hand.
Right.
Same thing for the shoulder. I have referred pain in my shoulder. The area from your neck is C5, C6, C7, so my mid to lower neck. That area innervates a lot of your shoulder muscles. So let's say you have a problem on that nerve signal's not getting to those muscles as well. Those muscles aren't firing as quickly, they're not recovering as well, they're more fatigable because they're not getting their signal. Well, now that would lead to more strain on the shoulder itself, or just a reproduction of pain that's not actually coming from that area.
And so because of the weakness of it, it's much easier to be torn? Could
be easier. Well, again, so the way that we treat a shoulder labral tear is to try to strengthen around it. So you can almost kind of reverse correlate that if there isn't strength, the tissue, the non-contractile tissue, the labrum needs to take up more force. So if the muscles aren't helping the shoulder out, now it's the ligaments, the capsule labrum that are going to take up more of the force.
And in your case, you were what position?
Pitcher.
So, okay, so you were definitely utilizing the shoulder
I was utilizing
quite a bit,
the shoulder.
Applying a lot of force to it. Now, you no longer play baseball, so was this a career-ending
Yeah, pretty much.
injury? Okay.
And it probably didn't have to be. if I would have the right treatment. But kind of buried the lead here.
Okay.
I retore my labrum.
After baseball?
After my repair.
Like recently or years ago?
Years ago.
Okay. What were you doing?
I don't know.
Well, that's the start.
Why? So I never. So after I had the repair, I went through the recovery. The recovery process didn't go well because it didn't fix. They didn't fix the problem. So I had a neck problem. I had cervical radiculopathy. I had a disc nerve issue, however you want to describe it, and I had shoulder surgery that basically just pissed off my underlying nerve issue. Mm-hmm. Right. Had to recover through it. I still tried it. I went back and I did play baseball again. I was never the same. But I've still, I played softball and I've rock climbed and bowled, and I'm a pretty big racquetball player. So I've used my arm since then.
When you played baseball after recovery, was there pain involved?
Yes.
And you just pushed through the pain?
Yeah.
Before you tore your labrum, was there pain involved?
Yes.
So it's just common as a pitcher, when you're pitching, to have pain?
Yeah, so, and this isn't the way you should approach this, but again, I loved baseball, and that was almost a problem. I would throw until my arm was basically dead. Like I used to drive stick shift. I would drive home after a game, and I'd have to shift with my other arm.
Wow.
And I didn't mind that because I loved playing. That being said, and again, I was 15, 16, 17, 18, like I'm just a dumb kid.
Right.
Right. I'm a dumb kid who my only thoughts were sports and something else,
Yeah. Comic books.
Right. It's food.
Yeah, of course.
Sports and food.
Right.
Shouldn't have done it. But again, now knowing what I know, I was just putting too much strain on my neck as I was throwing, and I wasn't offsetting that. And
so the act that you were doing was actually still the one causing the injury, but it was not to the
wasn't the area. Yeah. So I really want to get this information out there so that people know this. So kind of encapsulate it, no pun intended here, is that the take home is that you are about 50% likely to have a labral tear that has no pain whatsoever. There is no treatment for it to repair it other than an actual repair. Which is surgery, and it likely wasn't the problem in the first place.
So if you go through with the surgery, what's the recovery look like?
You're in a sling for probably, it depends on where the tear is and how big the tear is and stuff like that, and if they had to do anything else. If they had to repair any of the rotator cuff muscles, tendons, if they had to, they typically do what's called an acromioplasty, so they shave down part of the a bony projection of your scapula. And they might do some other debridement, stuff like that. Anyway, most of the time you're in a sling for about 6 weeks. Then you're doing a lot of passive range of motion, trying to restore mobility for about another 4 to 6 weeks. Then you start so for 12 weeks, 3 months, you're not moving your arm actively too much. Now, right around 3 months, you're starting to move your arm more actively, you're starting to strengthen. You should have most of your strength back by about 6 months, and then from 6 months to 9 months or a year, it's continued strengthening, return to prior level of function.
Now, in the scenario where someone gets, maybe not yours, but you have a labral tear, you get the surgery, how often does that remove the pain you were experiencing? Did it in your case?
No, I mean worse.
Made it worse.
Yeah.
So there was no positive change from the surgery and the recovery process.
No, and when you think about the tear too, right? They sew it back up. Okay, you ever have a tear in your shirt and you sew it back up?
Yeah, sure.
Do you have more shirt or less shirt?
Less shirt.
You have less shirt.
Yeah.
So when you sew that labrum back up, it is now tighter. It has to stretch out in order to allow you to get the same amount of mobility back. It often doesn't. And so you are often left with less mobility afterwards. So your shoulder's stiffer. If you want to return to a high level activity, baseball, you need a lot of mobility in your shoulder. You're probably not going to get it. And again, it probably wasn't the problem in the first place. If you're out there and you're in pain, if you're tired of the current medical system, failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way. Look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio. Like I said, I have a tear in my shoulder right now. I weightlift. I do a whole bunch of pull-ups as part of a program. I play racquetball. I do
same arm you used to pitch with.
Same arm.
Okay.
So this arm is basically trash. You know, it doesn't hurt. I don't have pain, numbness, tingling running down my arm, and I still did for a long time until I really realized that it was my spine, that it was my neck, and a lot of that is what has caused or bred this thought process or my treatment philosophy. Is because I realized that for myself and everybody I had gone to, I can't tell you how many different conventions, this is going to sound like a brag, but I have 4 or 5, depending on how you look at it, advanced orthopedic certifications. In order to get that, I have to go to a bunch of courses, and I have to learn from a bunch of experts in my field. And at every single one of them, whenever there's an opportunity to volunteer to have somebody look at my shoulder, I always took that opportunity. I can't tell you how many different treatment approaches that I've had to my shoulder, and that just haven't worked. And with that, how many different, shoulder dyskinesia, scapular dyskinesia, sixth scapula syndrome, axillary nerve damage, all of these impingement syndrome, bicep tendonitis, tendinopathy, whatever. All of these different diagnoses that people would have, and the treatments that arrive from those diagnoses that just didn't work.
So now that your labrum is torn again, but you've treated the underlying cause, which was your neck, with whatever you probably keep up with, but you're saying you're resuming lifting weights and racquetball and all that stuff. So you don't have the pain, but do you have limited mobility with it, or
No.
just kind of normal, back to normal?
It's normal. Well, and again, remember, and so it is normal to have a labral tear. Normal. To have a labral tear, 50% by the time you're 50, without pain. All of these 50% that I'm saying, these people had no pain.
What about an athlete who's like in their 20s, tears a labrum, doesn't get the surgery, but does like your treatment? Would they be able to return to the sport?
Most likely, yeah. It depends on how big the labral tear is, and it depends on what their position is in the sport.
Okay.
And at the very least, though, before I would have that surgery, I would address the neck. And then you'll see what symptoms you're left with, or what limited ability or not you're left with. But at the very least, you need your neck addressed. So if you've been diagnosed with a torn labrum, did your doctor say that, by the way, you're 50% likely to have a torn labrum without any type of pain? Nobody's going to say that. Did your doctor tell you that you very likely, that it could also be a problem from your neck? I guarantee you people aren't going to say that as well.
Yeah, definitely not. Because if you go to the doctor and they say you have a torn labrum, you're going to be like, oh my God, what did I do? It must have been when I did this or whatever. But knowing that like half the people have it just because of their living their life puts it in a much different perspective.
And again, half the people have it without pain.
And noticing, yeah.
And I actually think it's lower. I think that number is quite a bit higher. And I'm not saying that more people have a torn labrum. I'm saying more people have a torn labrum without pain.
Yeah, and they don't even know it.
They don't even know it. But it's getting wrongly correlated to their symptoms when they get imaging, and the doctor says, hey, on this image, we can see a torn labrum, this is your problem.
So where would symptoms show up that people would commonly be diagnosed with a torn labrum?
Any type of pain in the front, top, or back of their shoulder, right around here. But again, for me, and I've seen this clinically time and time again, I had pain, numbness, tingling, running down my arm. A lot of times people will get pain down into like the deltoid area of their arm, into their biceps, into their forearm. They'll get pain into their hands. They'll have pain up into their neck. They'll have pain down into their like shoulder blade. Mm-hmm. And the doctor's still telling them that this is your labral issue. This is a labral problem.
Because it shows up in an image.
Because it shows up on an image, and they can just say, this is your problem. This is what I can fix for you.
Well, and in theory, if they do that and then they give you the cortisone injection or whatever, the pain goes away.
Pain goes away, so you were treated. You're like, the doctor treated me. Yeah.
So it was my labrum the whole time. But really, no. Potentially.
Well, and you weren't treated.
No.
You were numbed. Your pain was managed, but your problem wasn't treated.
Yeah.
And that is almost, that's in a nutshell, our medical system.
Is there other diagnoses that are treated similarly? Like you just said, like tennis elbow, would that be the same kind of treatment?
Of the same treatment that I do? Or
yeah, like the same exercises and stuff?
Yeah, so anything that is arriving from your C5, C6, C7, and then we'll say nerve root C8. So I said nerve root. The C8 is just a nerve, not a spinal level.
Obviously.
Right. Anything that would arrive from about that, which would be some front lateral shoulder pain, so in the deltoid area, pain on the top of your shoulder. You'll get a lot of people misdiagnosed with impingement, misdiagnosed with a bone spur, misdiagnosed with adhesive capsulitis, pain running down the outside of your arm, so the outside of your elbow, so tennis elbow, carpal tunnel symptoms, so pain down into your thumb, index, and middle finger. You have 4 labrum.
I potentially probably have one that's torn, honestly.
At least 3.
It's barely hanging together over here.
And the other one's not looking good either.
No, that's all right.
All right.
I was looking up just like some common facts for labral tears, and when I was looking up like athletes that have them, most of them are football or baseball players. Do you think most of them who have been diagnosed with a labral tear that would need surgery and things like that, do you think they're also part of that group who just has that neck pain? I mean, especially for 100%. Football, they're getting hit all sorts of different ways, and their neck is, I'm curious, just, we've talked about before, like they don't necessarily get better treatment than the common person.
Yeah,
they kind of get the same treatment.
At the very least, if you have a torn labrum, you have to clear the neck first. And in general, our healthcare system sucks at that. You're going to say, they're going to get people to say, oh, I screen the neck all the time, and your screening sucks. Treat it. Treat the neck. And your treatment probably sucks. And I don't want to be too caustic here, but I disagree with a lot of the treatments that are offered and a lot of the diagnoses that are offered to patients, unfortunately. And that's why we're here, right? We're here because we see something different, and that's the information we're trying to get out there. Start by doing mobility exercises at the neck aimed at treating the C5, C6, C7 area of the neck, and see what changes.
And it's not that we just treat other people differently. You're literally a testimonial for this entire process of the labral tear and going through the system.
I went decades in pain.
Yeah, so
decades in search of better treatment for myself and for my patients. And that's how I came to this philosophy. I kept failing. Mm-hmm. I kept failing at getting myself treated. I kept failing at getting my patients fully treated. And the more and more I looked to the spine, the better and better I got, the more successful I became, the more successful my patients were recovering and staying recovered. And all of a sudden, it's almost like it was a light bulb moment where it was like, hey, like this might be more of a problem than everybody realizes. So that's our show for this week. Hopefully we answered some of your questions. If you have any other questions, you can reach us at info@thespinaltruth.com. You can follow us on YouTube, Spotify, Instagram, TikTok for right now, anyway.
Potentially when this comes out.
Maybe.
We'll see.
Facebook, and there's probably something else we're on.
We're getting out on all the socials. All the new ones.
We're on, aren't we on a lemon thing now?
Lemonade. Get us on Lemonade. I don't even know what that is yet, but we'll find out.
Follow us on Lemonade. All right, thank you for watching.